Hi, it's Jared O'D here, Director of Training at Dynamis, and in this video I want to introduce to you our Safe Holding course, which we've been delivering for many years now in care homes where the staff look after older people who may have dementia. We reference Royal College of Nursing guidance on this topic quite extensively in order to improve your team's knowledge, their skills, and their judgment that they may need to make the best decision possible about restraining an older person who may be frustrated or confused or aggressive or violent. Now, we always challenge staff working in care homes for older people with a very simple question, which is, why are you treating your patients and residents in such a way that they are getting frustrated, scared, angry, and possibly violent? And this is something that we use to really challenge and stimulate the staff at the very beginning of a training day to get them thinking about what is it about their behavior or their approach which might be causing these situations to happen. Interestingly, Martin Fletcher, who was the Chief Executive of the National Patient Safety Agency, in a letter he wrote that was included in this guidance, said, "If staff don't have a clear understanding of the circumstances where restraint is justified or positively required, then they won't be able to recognize circumstances where restraint is wrong or abusive." And we absolutely believe that education about restraint and the rules that are attended with it will really help your staff to make sure that they're not abusing your residents and patients. Now, unfortunately, when we look in the news on a monthly basis, we see stories about staff who are making bad decisions about restraint, whether that's because of lack of resources. Overworked staff often make these kinds of bad decisions about restraint, or whether it's stories of physical assault happening in a resident's room and a member of the staff team responding to that in a very personal way instead of a very professional way. Sometimes we see entire teams of staff making bad decisions, and we must ask questions then about the culture of the decision making around restraint in some of the care homes. So the objectives in broad terms here are that we want your staff to understand what exactly restraint is, the legal and ethical issues around that, and the rules that are attendant. When they know the rules, your staff will be able to recognize abuse immediately. We want to talk about minimizing the need for restraint, and by making sure that our residents aren't becoming frustrated or worried, scared, anxious about our approach to them, we can reduce the need for physical restraint and interventions. In some circumstances, then, your staff will have a duty of care which will encourage them to think physical intervention is the best way to resolve a situation. And there are situations that we know about in care homes where your staff must physically intervene. When they physically intervene, it's really important that your staff know how to minimize the risks of a restraint. Of course, there are risks of injury and risks of serious harm from restraint, and we have to be making the best decisions possible. When we teach physical restraint and interventions in a care home environment, we have to reference the guidance that speaks to this issue. And one of the more important pieces of guidance that we like to use is Mental Welfare Commission guidance about the rights, risks, and limits to freedom, which is guidance that was issued some years ago and is regularly updated. But one of the most important concepts for your staff to get on board very quickly during a course like this is that any time that they limit their residents' freedom, this could be a restraint or a restricted practice. A really good plain English definition of restraint that we like to introduce to your staff is that any time they're stopping a person doing something they appear to want to do, that's a restraint. And this really prompts some very interesting discussions with your staff, because the next question we follow up with them is, what types or what categories of restraint do they know of? And very quickly, of course, they look at our trainers and they know that we're there mainly to teach them about physical restraint. But actually, we like to broaden their awareness and make sure that they understand that restraint covers many different activities or practices that they might be doing regularly with their clients. Now, having gone into that in great detail with them, much more detail than I'm going through with you right now, We spend a bit of time looking at what we call positive guidance. And again, we return to the Royal College of Nursing document called Let's Talk About Restraint. And in that document, it gives us 5 scenarios where adults who may be at risk can be justifiably restrained. And we spend some time with your staff exploring those 5 sets of circumstances so that they're very clear about the kinds of issues we're discussing. Now, we really want your staff to be making the best decisions possible, so we have to explore with them the guidance as we've discussed so far in this video, but also then we need to go ahead and make sure they're aware of some of the legal standards, some of the health and safety issues that are at stake here, and then give them a broad understanding of the use of force law. And just here on the screen, I wanted to give you some of the headlines that we cover with the staff. They have to understand the framework in which they're working, this idea of reasonable force, of the use of force only as a last resort and in a proportionate way. We have to also look at the Mental Capacity Act and the various requirements that that has in terms of restricting a person's freedom. And really, in order to apply this in the best possible way, any kind of restraint should be in the person's best interests. Now, this word reasonable pops up very often in our training, and there are 2 key areas in which it's applied. Your staff have to understand what the use of reasonable force means, and they have to apply it in a context of taking reasonable care for themselves and for their residents and for the other staff around them, their colleagues. And so we make sure that they understand these rules, and then we have them apply these rules to various case studies. Some of those case studies might be clinical in nature, and some of them might be more violence, aggression management in nature. Either way, we really want your staff to be using the principles we've taught them, the legal standards that apply, and making the best decisions possible about these various cases that we show them. We also show staff a number of stories about where carers have been involved in real situations of violence and aggression, and they've made the best decision they could in the circumstances they were in, but maybe they got injured or hurt. And we use these stories to talk about risk management. We use them to talk about what is the worst that can happen in a given situation and how can we make the best decisions to make sure that we don't end up injured or we don't end up injuring a client. This is a really important part of our course because it makes your staff think about the risks that stack up on both sides of this physical intervention decision. Some years ago, there was a story about a care worker working in a care home in England who was actually killed by a resident in her care home. In other stories, we have to look at the risks that we're exposing our residents to. This story here and the research report on the left-hand side of your screen talks about the risks of bed rails and how bed rails can actually be really dangerous if they're not used in the correct way for the correct people. Of course, we have device bulletins and various advice and guidance issued about these incidents that happen, and they happen far too regularly. But nevertheless, we like to, in our courses, make sure that your staff are aware of these issues and the scenarios that have occurred so that they can improve their level of awareness and thereby be more careful and make better decisions. So, over the past few minutes, I've hoped to introduce to you the broad topics that we introduce to your staff on our courses. And if some of this sounds like it would be good for you to bring to your care home, then we'd love to speak to you. Please give us a call on 0844 812 9795, and me and my team here at Dynamics can start working with you on creating a safe and secure environment at your care home. Thank you.